LiveView has been a great addition to our hub facility. We can now look at social care records for patients that we might be dealing with who are vulnerable and have additional needs. So a few examples of what it's been useful for are patients who've come out of hospital, had a particular patient with very complex needs and a very complex care package. It was delayed for several weeks because of the size of the care package, and when he was discharged it was all done rather quickly, and the discharge summary made no reference to the care plan whatsoever. So by going on to LiveView I was able to go in and verify before I visited who the care agency was, how many visits they were having, that those visits were happening in pairs, and see that things were sorted. So it was very useful if there were any difficulties cropping up to know who I was dealing with, to liaise with them. Another instance where LiveView has been extremely useful is social care left a message about a patient who was neglecting themselves, and the message that was left at the hub was quite non-specific. We were able to talk that through in a multidisciplinary meeting and review the care records on LiveView to get a little bit more in-depth view of what was happening and the recommendations and plan that needed to go in place. And another example is one of those individuals who was in hospital, came out of hospital, but unfortunately their respite care had been cancelled because they were in hospital and the carer was struggling with the responsibility of caring for that individual who was now more disabled, and was wanting to know what was happening. And in the past we wouldn't have any idea of what was happening in social care. We just knew we were waiting for something, but I was able to log in real time with the carer present and actually be able to look and see what was happening, and then go forwards with that knowledge to address the next steps to get that respite care reinstated. So I think bringing health and social care records together in this way has really made it easier for us to do what's right for the patient and try and improve the service and the coordination of that service for the individual and their carers.